Vestibular neuritis is responsible for about 6% of the cases of dizziness in the U.S. It is a medical condition that occurs when a nerve called the vestibular nerve, which is located in the inner ear and is responsible for maintaining overall balance, is inflamed. The vestibular nerve is commonly inflamed during infections such as viral infections from an upper respiratory tract infection or an inner ear infection. So how does vestibular neuritis come about? To better understand how this condition comes about, let's first look at the basic overall structure and function of the ear and the vestibular nerve. The ear performs two basic functions. Firstly, it assists in hearing, and secondly, in maintaining balance. These two major functions make up the auditory system and the vestibular system, respectively. The auditory system and the vestibular system are controlled by an important structure called the vestibulocochlear nerve. The vestibulocochlear nerve is made up of two branches, the cochlear branch, cochlear nerve, and the vestibular branch, vestibular nerve, which control hearing and balance, respectively. The vestibular system, which helps maintain balance, consists of three main structures called the semicircular canal, the utricles, and the saccules. The semicircular canals consists of fluid-filled tube-like structures lined with hair-like receptors. These tubes are filled with a fluid substance called the endolymphatic fluid. These hair-like receptors sway in various directions in response to specific rotational body movements. The swaying motion of these receptors in turn relays sensory signals to the vestibular nerve, which in turn transmits these precise positional sensory signals to the brain for interpretation to help maintain balance. The utricles and saccules likewise consist of fluid-filled tube-like structures that are lined with hair-like receptor but coated with tiny little floating calcium carbonate crystals. The orientation and position of these calcium carbonate crystals at any moment in time is in relation to gravity. The swaying motion of these hair-like projections and the calcium carbonate crystals in turn relay sensory signals to the vestibular nerve, which in turn transmits these precise positional sensory signals to the brain for interpretation to help maintain balance. So what happens during vestibular neuritis? When the vestibular nerve is irritated, such as during an infection of the inner ear, the nerve malfunctions. As such, it is unable to precisely receive and transmit external body positional signals incoming from the sensory receptors in the ear, semicircular canals, utricles, and saccules, to the brain. Consequently, the body's ability to maintain balance is impaired, leading to the feeling of dizziness, which is often present. What are some of the causes of vestibular neuritis? A common cause of vestibular neuritis are viruses, such as the herpes simplex virus, influenza virus, Epstein-Barr virus, measles, para-influenza virus. These viruses are able to gain access to the vestibular nerve by directly infecting the ear, or indirectly by first passing through the upper respiratory tract before gaining access to the inner ear structures. What are the risk factors of vestibular neuritis? The factors that increase the risk of developing this medical condition includes having an ear infection, a throat infection, or an upper respiratory infection. These infections typically occur prior to developing vestibular neuritis. So what are the symptoms? Symptoms include sudden onset of dizziness and poor balance accompanied by severe nausea and vomiting, which may last from a few days to weeks before the symptoms resolve. How do we diagnose vestibular neuritis? The diagnosis is based on clinical findings, such as a description of the symptoms experienced by the patient, the triggers, any preceding infections, such as an ear infection or an upper respiratory infection, and findings on physical examination. A unique finding on physical examination which your doctor may look for are findings of abnormal eye movements called nystagmus, which can be triggered by having the patient fix their gaze in a certain direction while the head is gently turned side to side. This is called the head thrust test. So how do we treat vestibular neuritis? We focus on two very important aspects when it comes to treatment. Firstly, educating the patient on the underlying cause, mechanism, and prevention of vestibular neuritis is very important. Secondly, focusing on controlling the symptoms that are discomforting to the patient, such as nausea and dizziness, is of paramount importance. For instance, the symptoms of nausea and vomiting can be managed with certain medications, such as Zofran, while the symptoms of dizziness can be managed with other medications, such as meclizine. In addition, steroids can also be used to reduce inflammation of the vestibular nerve. Will my vestibular neuritis ever go away? Well, the good news is that vestibular neuritis symptoms will eventually improve and stop over time, especially once any underlying ear or upper respiratory infection resolves. However, in about 15% of patients, the symptom may yet go on for up to a year. Here are a few questions you may ask your doctor about vestibular neuritis. What is the cause of my symptoms? Can my symptoms recur after it is treated? What are my treatment options? How can I prevent these symptoms from recurring? Can a stroke cause similar symptoms, and if so, how can I tell the difference? What should I do if I think my symptoms are due to a stroke? Here are 5 take-home points on vestibular neuritis. Firstly, vestibular neuritis occurs when the vestibular nerve is irritated or inflamed. Secondly, it is preceded by an ear or upper respiratory viral infection that inflame the vestibular nerve. Thirdly, symptoms include sudden onset of dizziness accompanied by severe nausea and vomiting, lasting from days to weeks. Fourthly, vestibular neuritis is a clinical diagnosis. Finally, treatment may include steroids to reduce the inflammation of the vestibular nerve. In addition, other medications to help control nausea and vomiting. Ready to try a few practice quiz questions on this topic to test your understanding? Question 1. What is vestibular neuritis? A. It is a type of mild seizure that causes dizziness. B. A cause of dizziness due to inflammation of the vestibular nerve which helps maintain balance. C. It is a severe migraine headache that causes dizziness. D. It is a type of stroke that causes dizziness. E. It is a mild constipation caused by the flu. The answer is B. Question 2. What are some triggers for vestibular neuritis? A. Skipping meals. B. Uncontrolled high blood pressure. C. Upper respiratory viral infections or ear infections. D. Taking too much aspirin. E. Excessive sweating. The answer is C. Question 3. How do we diagnose vestibular neuritis? A. The diagnosis is based on clinical findings. B. By performing an eye exam. C. By performing a chest X-ray. D. By obtaining a blood test. The answer is A. Question 4. How do we manage vestibular neuritis? A. By taking the flu vaccination. B. By drinking 1 cup of water every day. C. By taking medications to stop seizures. D. Avoiding triggers, taking medications to control the dizziness and nausea. The answer is D. Question 5. What are some symptoms of vestibular neuritis? A. Passing out for a brief period of time. B. Arm weakness. C. Sudden severe headache. D. Slurred speech. E. Sudden onset of dizziness accompanied by severe nausea that can last for days. The answer is E. Thank you for taking the time to learn with us today. We hope that the information presented today was of help to you. If you found this information helpful, click the like and subscribe button for more videos. Until next time.